Good afternoon. Today it gives me great pleasure to interview Maria Carrera. Maria, can you introduce yourself, please?
Oh, thank you, Jonathan. Good afternoon. I am Maria Carrera Ferrer. I'm clinical psychologist, and I work in a children, adolescent mental health service. And I coordinate the treatment to eating disorders, attention to eating disorders at these ages, from 9 or 5, 9 to 17.
From such an early age, no? From a very early age.
There are few, but some of them are people less than 10.
Less than 10.
Under 10, sorry.
Under 10. And what really are eating disorders? Can you explain what eating disorders are?
Well, eating disorders are a group or constitute a group of mental illnesses. It is an illness or illnesses because there is a group of eating disorders are diverse types of illness, and in which the person is very concerned about her or his body, most women, and develop behaviors in order to control the weight and feel better with themselves. These behaviors compromise the person's health and produce big suffer and isolate this person. They are not able to go to eat with peers, to attend to a party, and they bit by bit become isolated. The main behaviors are reduce eating or refuse to eat at all. And then some of them use vomiting or excessive exercising to lose weight. And sometimes they are diuretics or laxatives. As I said, there is a group of illnesses, and the main are anorexia nervosa, bulimia nervosa, and binge eating disorders.
It's very interesting. You talk about illnesses, not illness.
No, it's not. It's a group.
A group of illnesses.
Varies a lot, and you can find a restrictive anorexia nervosa or purgative anorexia nervosa. Bulimia is always purgative, or almost.
Mm-hmm.
And there is binge eating, and there is another type of eating disorders. There is given in more children, about 10, 11, that are very, very selective with the food. So they are not concerned about their body images, but they don't eat. So they fail in growth or in gaining weight. And this is another type of eating disorders, not the most, but we have to treat it also. So
it's very, what I find interesting and alarming is the emphasis on the body image, and maybe the body dissatisfaction. Can you explain a little bit about this, the body dissatisfaction?
Yes, it is one of the nuclear problems in eating. Behind it, there is a low self-esteem in most of cases. Many teenagers believe that they are not good enough if they are not thin or slim, and they will not be valued for the others. And at these ages, people or teenagers need to be accepted by the others, by the group.
Yeah.
And they decided they are not good enough, or her body is not good enough.
So,
There is, in
yeah.
fact, there is a misperception of their bodies and see themselves as fat or not fitting with nowadays ideal of body woman.
This is a very the ideal body of, for example, a girl or a woman at that age, and this is induced also by social media, I suppose. No, social media is a big problem.
Yes. Social media, and lately in the last 3 years, above all after pandemic, electronic devices. They are always in the internet, in the net, TikTok, and other types, WhatsApp, etc. No, and what they see in the screens, in the electronic devices, is not reality, but they believe it is. For example, they see a fantastic woman, very fashion, very cool, and they think this is reality. They want to be like that woman, that young woman.
Yeah.
The influencers, you know.
Yeah. The influencers.
They believe this exists, and they believe that they are not good, and try to copy these persons, these people. And on the other hand, there is a big problem now that it is bullying. Bullying has always existed, but if you say something in other way to another pair, nobody knows. But now, if you say you are grown, you are fat, you are X, you are something, immediately it has a big diffusion into the net, WhatsApp, TikTok, Instagram. So this is a big problem.
So this reduces the self-esteem,
yes,
and increases the isolation of the young people.
Completely.
So, Maria, this enormous problem, which is growing, I think, these groups of illnesses, can young people recover from eating disorders, and how?
Yes. About 80% of the patients recovered. The process is very long. You can speak, or you can tell this person has recovered. 2 years later, the problem began, or maybe 3 years later, but they recover. The key for success is early detection and treatment by an expertise team. I insist, early detection and treatment. An expertise team. However, and unfortunately, not everyone recovers. About 20% of the patients suffer on life from eating and must be treated as long-term chronic patient, also with specific care. It doesn't.
No, the 20% is a lot.
20% is a lot. Most of them have other associated psychopathologies, for example, obsessive compulsive disorder disease. Disorder. And depression, deep depressions.
Severe depression, major depression. And you talk about early detection, but the teenager is, I suppose it's difficult for the teenager to detect it. So it must be the mother or the father. And sometimes it is a complicated relationship. No?
Because the people, the father, the mother, trust her daughter. I always speak of women because they are most of women.
Yeah.
99% more or less. And people trust the daughter when they are about 13, 14. You are not looking at them when they are taking a shower or they go to buy her own dresses. So many times they eat school, they at school, and sometimes very difficult to see what is happening. And they say, no, I have lunch with my friend, or I went to grandma and she gave me a glass of milk and some biscuits, and it's okay. Parents don't know what is happening.
And this is critical.
How you detect it? The girl becomes sad, for example, becomes very active with the necessity of doing a lot of exercise. She always covers her body, for example. She doesn't sleep well, is very involved in studies, very excessive.
Excessive is the word, no? Obsessed.
Always thinking in study, exams, etc., no? Tests, all of these types of things. And maybe sometimes father or mother can find food in the trash. Sorry.
The trash or in the rubbish, the food in the rubbish. Yes. Yeah.
The rubbish, or sometimes can find vomits.
Yeah. It's such an important issue, and as you know, very often mental illnesses are pushed to one side, although I think this is changing. And this is a very difficult set of diseases because it's like a combination of mental and physical, really.
Yes,
suppose.
right? It is both.
And what advice, to end this very short interview, because I would love to continue for longer, but what advice would you give to educators or to young professionals in treating young people with eating disorders?
First of all, you have empathy. Believe them. Don't think there is a nonsense that is, I don't know the word now, capricho.
Which is like a caprice. We can say caprice.
Caprice, yes. It's like caprice, it will pass. Don't believe this is serious. Try to convince. And for the fathers or for the mothers, to the parents, don't be raw.
Don't be rough or hard.
Don't be rough, hard. Don't shout, cry.
Yeah, don't shout at
Don't
make them feel guilty.
Make them guilty.
Yeah.
Because this is a disease. And to prevent eating disorders, educate for health and family at the school, teach about nutrition and benefits of physical activity, inculcate values such as tolerance, educate in diversity all of us are different and diverse, deserve respect. All bodies are different and no one is better than the other. Teaching children to be critical, being able to distinguish what is true or false, what is right or wrong. To educate children to be assertive, that means capable to explain what they want, what they need, what they are feeling, and how to say, no, I don't want this. And lately, lastly, in the last times, educate children in the use of electronic devices.
I think your pieces of advice are fantastic. And I thank you very, very much, Maria, for agreeing and giving me this interview. And thank you very much, Maria.
Thank you very much to you, Jonathan.